Hi guys, Assalamu alaikum. My name is Chandni and I'm studying pharmacy at UCP. Today I will explain you how Survanta can prove a life-saving drug for neonatal. So let's start with our today topic. Chapters to be covered in this video is what is Survanta, uses and dose of Survanta, interaction with other drugs, how it can be administered, mechanism of Survanta, and adverse effect and drug toxicity. In hospitals under the world, the thousands of the cows and pigs are saving the baby's life. Sometimes the babies are born with a gestation period of less or more than 28 weeks. That babies are called the premature babies. Many premature babies are born with underdeveloped lungs. This often led to the condition called neonatal respiratory distress syndrome. Minutes after the birth, this baby starts breathing rapidly. There is nasal flapping, there are chest wall restrictions, and their extremities turns blue. That leads to the condition called cyanosis. Due to lack of surfactant, the alveoli in the lungs get collapsed, and this happens the baby trouble to breathe. The surfactant from the cow's lungs and the pig's liver can actively mimic the proteins produced by the humans. Injected into the baby's lungs, this surfactant prevents the baby's alveoli from collapsing by breaking up the attraction between water molecules. The thin layer of water coating the air sacs produces the surface tension, a phenomena that keeps the alveoli thin and rigid. Adding surfactant to the alveoli keeps the alveoli slightly inflated and makes it easier to breathe. With the surfactant, the baby breathes easier and have a greater chance of survival. Uses and dose of Survanta. Prematurity with the respiratory distress syndrome, meconium aspiration syndrome, pulmonary hemorrhage, pneumonia, ARDS, and congenital diaphragmatic hernia. The usual dose of Survanta is 4 ml suspension per kg body weight according to the dosing chart. Drug-drug interaction of Survanta. No drug interaction in Survanta is observed. Surfactant preparation. Warm to the body temperature. Hold in hand for 8 minutes. Do not shake. Discard if discolored and check the seal. Wash your hand properly. Wear your gloves and glasses. As a recommendations of the surfactant, use the PAP immediately after birth. Consider the surfactant administration alternative to routine intubation and as a prophylactic means. Let's do a case study. A baby boy AJ with a gestation period of 27 weeks and the body weight was 880 gram. The tidal volume was 4.5 ml per kg and the precaster pressure in the heart was 28. The respiratory rate observed was 30 and the oxygen requirement was 50%. First, the dose was divided into two aliquots. Place the baby at one side and administer the surfactant and wait for 30 seconds to 1 minute for advocate surfactant administration. Now, reposition the baby to the opposite side and administer the second aliquot. During administration, the conditions to be monitored are chest rise and fall, oxygen saturation, heart rate, and tidal volume. Two types of administration methods are used in surfactant replacement. The first is ensure method that is followed by intubation, surfactant, and rapid extubation. And the second one is Lisa, that is without intubation technique. The mechanism of action of Survanta is same as inflated balloon, as the less force is required for already inflated balloon. The role of the surfactant is same as inflated balloon, as it keeps our alveoli slightly inflated so that we can breathe easily. Here we can see that without the surfactant, the alveoli are get collapsed after breathing. While in the second figure, when there is a surfactant and the alveoli do not collapse even after breathing. Let's talk about the adverse effect of Survanta. In mechanically breathing infants, intracranial brachicardial hemorrhage is observed and the pulmonary hemorrhage is also observed. In Ensure and Lisa technique, bradycardia and hypoxemia is observed. Thank you so much guys for watching my video.